So, food security. This is an Inuit Elders Feast up in Iqaluit that I was fortunate enough to go to last year. It's estimated that 1.1 million households in Canada experience food insecurity. And we know that 900,000 people, close to 1 million people, rely on food banks to provide their basic dietary requirements. And we also know that food banks are just a band-aid and they're really not the solution. We also know that many people are unable to cook or prepare healthy food that they may get at a food bank because of their housing situation or a lack of knowledge. Many chronic medical conditions are exacerbated by poor nutrition, and sometimes they're partly caused by it too. And healthy, nutritious food is really a luxury for many, and it's an impossibility for others. Flying into Nunavut, you can spend up to $5 for a single apple. So complicating much of the issue of poverty is really the elephant in the room. And this is mental health and addictions that I've already mentioned. So mental health and addictions issues, of course, cross all cultures, educational levels, and socioeconomic status. But the problem is much worse in people living in poverty and in marginalized situations. So mental health is generally, in these populations, as I already mentioned, managed more as a crisis rather than by early and constant intervention and treatment. And with our federal government's war on drugs approach to addictions, which we actually know to be a failure, the problem is worsening. Now in Vancouver, we do have North America's first safe injection site, the Insight site, and the Canadian Medical Association was a key intervener in the Supreme Court decision, actually, that led that site to go through. And we know that the Insight has actually reduced morbidity and mortality and the spread of infectious diseases such as hepatitis C and HIV. And it also has increased the rate of addicted people actually getting into treatment and staying clean and sober. But there continues to be a war on this harm reduction approach in Canada by the federal government, which has put so many loopholes into the possibility of developing any other safe injection sites that it's beyond ludicrous. So in my backyard in the north, mental health and addictions are the big health issue. And perhaps it's most stark in Nunavut. This is a Nunavut grave, where the rate of suicide by Inuit men aged 19 to 24 is 50 times the Canadian average for men in that age bracket. This issue is so intertwined with the social determinants of health, as well as issues of colonization and colonialism, that it is impossible to look at it in isolation. We know that 30,000 people are homeless on any given night in Canada. This is the downtown east side, but it could be here in Montreal, it could be in Yellowknife. As many as 50,000 people are also considered to be the hidden homeless, or what we call in the emergency room, the couch surfers, who live with family and friends with no prospect of finding any permanent housing. We know that premature death is 10 times more likely in the homeless population. Now, I work in Yellowknife. Yellowknife is actually the coldest city in Canada, and temperatures routinely plummet below -40 for weeks at a time in January and February. And you may find this hard to believe, but we have a huge homeless population there. And many of the people there are addicted. Many are suffering the multi-generational legacy of residential schools and the effects of colonialism and loss of their culture. Many of the people didn't grow up in Yellowknife. They arrived in Yellowknife for various reasons, maybe to seek medical care, and they could never get home to their community. They maybe had a few drinks and they couldn't get back on their return flight. And there's no home usually for them to go back to. So even in a few years, if they do sober up, they cannot go back to their home communities because there is no housing there. I visited Cambridge Bay and Nunavut last year on a tour actually with the federal health minister, Leona Lukak, and that's her home and her home riding. And nurses told us the story of a pregnant woman who spent most of her pregnancy, including in the winter, living underneath one of the trailers because there's nowhere else in town for her to live. And yeah, that was a very stark story. So in Yellowknife, we only just recently got a day shelter last year. Prior to that, our women were housed in a shelter and men were at the Salvation Army. And during the daytime, they would call the ambulance up to 6 to 8 times a day just to get a ride to the emergency with different complaints because they needed to get out of the cold. We do have a day shelter now. Our rates of emergency use have gone way down, and the justice system, or the policing system, is much less stressed too. But at night, we still always have homeless people in our department, and they're lined up in the chairs in the waiting room, and it's against policy, and we're told the next day we have to kick them. Can never do that again, but we do it every night, because what else can you do? So the healthcare costs are staggering, but most importantly, it's the human costs, what we need to remember. So we do know that 7% of Canadians live in crowded or substandard housing, if they have it, and this is Northern Ontario. This is not, sorry, it's not working. Yes, thank you. Yeah, it's not, but it's one of the other northern communities in Northern Ontario. So we know that over 380,000 Canadians living in poverty are spending more than 50% of their income on rental housing. And we also know the devastating effects of substandard housing on homelessness and health. Now, right here in Montreal, there's, from what I understand, over 30,000 social housing units, and there's another 22,000 households on the waiting list to get into those housing units. We also know in Montreal that more than 75% of substandard housing is occupied by immigrant families. Now, the Mental Health Commission of Canada has recognized this with understanding that, what they say, recovery begins with a place to call home. And they've advocated for what's called the housing first approach to mental health and addictions. And the CMA has been advocating hard at the federal level. And kudos to this federal government. They actually have adopted those recommendations from the Mental Health Commission and are approaching a housing first approach for mental health and addictions. What we are asking they do is actually take that approach for all illness. You can't get better from any chronic illness unless you have housing. So we know that investing in supportive housing can reduce the costs associated with the healthcare and the justice systems. And a couple of years ago, I had to go to court to testify in a sexual assault case, but I listened to the case ahead of the one I was testifying at, and there was a man who was being put back in jail for about the 10th time, and he kept getting arrested and incarcerated for very minor crimes, stealing a little bit of something from the grocery store, that sort of thing. But he told the judge he was going to continue to do so for the rest of his life because he has no place to live and no money for food. And when the judge just gave him a 6-month sentence, he asked for 2 years. So that was a lesson for me. So does anyone know what this picture here is? Anyone guess where it might be? Well, this is in Nunavut, and this is what the C.D. Howe ship. And this is a tuberculosis ship that spirited people away back in the 1950s and 1960s off the land down to the south, often never to come back. And if they ever did come back, they didn't fit in. So this ship would come around, and these were the Inuit people out on the land, and sometimes just the mom and the kids would be there, and the men were off hunting. And when the men came back, the family had all gone, and they never knew where they were. And these people weren't able to articulate where they came from. Some of them were little kids. Many of them ended up in Hamilton, where I grew up, in the tuberculosis sanatorium there. And I suspect some of the elders I've met back in Nunavut in the Northwest Territories, many of whom have big scars across the back of their chest from having a lung removed. I suspect some of them spent some of their youth down in Hamilton. So really, the TB ship was the death of a community, and the term consumption is used for TB. And it's an apt term for more than just what it does to the body. It actually consumes a person's whole being, and it consumes a culture, and it consumes a community. So why am I talking to you about TB here today, apart from the fact that it's a passion of mine? Well, tuberculosis is not just an old disease or a disease of the third world. It's actually on the comeback, and it's on the comeback in Canada. And TB in Nunavik in northern Quebec is 8 times more prevalent today than it was just 15 years ago. And that is felt to be largely due to social determinants of health. So this is Cape Dorset up in Nunavut. And we know that TB is actually a poor person's disease, and that's why I want to address it with respect to basic income. It's a symptom of socioeconomic marginalization. And the rates of TB per 100,000 in Canada, in Canadians as a whole, it's 4.5 per 100,000. In the Inuit population, it's 304. So it's about 100 times or 80 times that. And in downtown east side Vancouver, it's on an alarming upswing. I don't have the up-to-date numbers there, but it's very endemic there. It's a respiratory illness, and the Inuit are overcrowded and they have substandard housing. They have poor nutrition, 70% of them smoke, many abuse alcohol and other substances. They have variable access to healthcare facilities. And there really has been a complete lack of interest of governments to address the problems of the poor around the country. And so we have a community breakdown as a result. And the same can be said for other urban refugee and immigrant marginalized populations. So I'm going to just get now to why everyone's meeting here today, which is a guaranteed annual income. So I'm just going to talk a little bit about this with respect to health. And some of you may know about the MINCOM experiment, which was a guaranteed minimum income experiment done in Dauphin, Manitoba back in the 1970s. And this was an experiment where eligible individuals would receive a guaranteed basic income through a refundable tax credit program. And recently, Dr. Evelyn Forget from the University of Manitoba, who's a health economist, has been reviewing the data from that study, looking at health outcomes from that program. And she actually has found that throughout the period where they had the guaranteed minimum income, that hospitalization rates fell, the number of physician visits dropped due to a substantial reduction in mental health complaints. The number of accidents and injuries decreased dramatically. Working mothers use more of the income to extend their maternal leave back in the time when maternal leave was only 4 to 6 weeks in this country. And I think what was really exciting is that high school rates increased substantially. High school completion rates increased substantially. So we know that one of the most successful public policy interventions in the 20th century in Canada has been the reduction of poverty amongst Canadian seniors. And poverty rate amongst Canadian seniors went from 36% in 1976 down to 6.7% recently. And this was accomplished largely through effective public policy interventions, the public pension, but also a guaranteed minimum income for seniors. Now we're seeing poverty rates, unfortunately, starting to rise, particularly in senior widowed women over age 75. And we also know that changes to the qualification age of the old age security from 65 to 67 may further undermine the progress in poverty for seniors. So one of the things we've talked a lot about at the Canadian Medical Association is using a health impact assessment tool that governments look at all of their policy decisions through the lens of health and how that policy decision would actually affect the health of Canadians. And this is a classic example of the changing of the old age security qualification age. So So we had from some of our work, our town halls and other work over the last year, the CMA has made a couple of recommendations to the government on guaranteed annual income, and we certainly indicated that all levels of government need to develop action plans to eliminate poverty. We also made a recommendation, this came from the suggestions from the participants at our town halls, that guaranteed annual income actually be evaluated and tested through a major pilot project funded by the federal government. Now, many people may not agree with another pilot project. I personally don't. I think we just need to get on with it. But this was certainly what many people felt. But I'm just throwing that out as a recommendation that came from those town halls that we have put forward. So what now? So we really need to promote the understanding of a link between a healthy society and a healthy economy. And this has been well shown. And you really cannot have a healthy economy without a healthy workforce. And we can't continue to run governments unless we put the money where it really needs to be, rather than spending it downstream where it doesn't need to be. We know that the cost of inaction is far more expensive than acting. And it really is too expensive not to invest upstream. We also know that social initiatives do need specific funding and should be viewed not as giving money away, but actually as investments. And we have to change our mindset around that. Public policy is key. We won't get anywhere without good public policy. And it has to be, there has to be federal public policy on a lot of these issues. Even though things such as health and education are provincial, territorial matters in Canada, without federal leadership on things such as basic income, national child care, that sort of thing, we're not going to get very far. We also need to use health impact assessment tools, as I mentioned. Physicians and other healthcare providers have to take leadership, and also other people, social workers, other people who actually deal with people living in poverty. And physicians are not experts in how to fix the social determinants of health, but we are the experts in dealing with the downstream effects of them. And the Canadian Medical Association has been much criticized by some of its members and non-member physicians for actually wasting its time on talking about social determinants of health and saying this has nothing to do with healthcare, we should be doing other things. But I think this is probably the most important thing our organization has ever done. So I also believe very much in grassroots leadership. So this is actually a group of kids in Montreal. And hopefully they're going to be the next grassroots leadership, because these are kids all living in poverty. So I think that solutions are often best and most powerful when they are community-driven, because then they're driven by a narrative. And the best way to actually capture people's hearts, the voting public and the politicians, is actually with narratives. And so top-down approaches don't always just work. Although we do need policy, we need those community-driven narratives to inform that policy. So governments need to be pressured to take action. And there's a clear role for each and every one of us, citizens, physicians, activists, all communities, to help deal with the problem. No one can fix it on their own. So anyone recognize this slide? From last year? Yeah, that's the Idle No More movement. And this is a great example of community activism, if you like, that has started to spread. People tried to poo-poo it, said it wouldn't go anywhere, but we're starting to now see much more Aboriginal issues on the radar. People actually taking it seriously, that they actually are real people. So this is what community activism can do, and I think all of us have to be part of it. So I'm just going to wrap up here, and I don't know if everyone can read this, but I'll read it for you if you can't. It says, "Equality means everyone, especially those who are the hardest to see. Open your eyes."